Page number 226, Micromineral iron. Please mention the page number of the new textbook also if it is the same. I guess only dietetics have different page numbers, but in nutrition science, the page numbers are the same. Okay. If anyone is joining late, please help them out with the page numbers or topic name. So with that, we'll start today's session. Last week in the Wednesday classes for disease conditions, those who haven't attended the Wednesday classes, the topic on anemia in detail was taken. Okay. So if at all any mentions of anemia comes in this chapter, I'll refer you towards that. So anyone who wants the disease conditions playlist, please WhatsApp me right now. Okay. Don't forget it. Anyone who wants the disease conditions playlist, please WhatsApp me right now so you don't forget it. I'll forward the disease conditions playlist. So usually what we will take in this week's disease conditions playlist, for example, this Wednesday, what topic we are going to take, okay? That topic, any chapter in nutrition science or dietetics pertaining to that particular chapter will be taken in the next week. Okay, so there will be a continuous. The chapters will be continuous, okay? Is it clear to all? WhatsApp me on my UK number. Just give me one moment. If you have Dini ma'am's number, you can, if you are from Dini ma'am's contact, you can mention, you can WhatsApp it to Dini ma'am as well. I have forwarded her the playlist as well. So Dini ma'am can also help you with that. I'm mentioning my WhatsApp number in the chat box. Please copy that. So whenever you come for the Monday, Tuesday classes, please check what we have done. Please take the playlist of disease conditions and see what was the latest video. So you will understand some of the topics, not every time, but majority of the time, some of the topics relating to the Wednesday classes of the previous week will be taken. Okay, so the students are better prepared, specifically the ones who are not from the medical background or the science background, they will be specifically prepared, well prepared for the nutrition and dietetics classes. Okay, you will have the clinical management, pharmacological management will not be taken in the disease conditions because that is not the forte of the nutritionist or dietitians. Okay, clinical management, medical management, surgical management are only approved and done by doctors who are specialized in that. Okay, so pharmacological management, clinical or surgical management will not be taught. Just a brief will be given to you. So these are the options usually in general cases patients may have. Okay, just to give you the knowledge of that, but not in detail. Okay, only the dietetic management, nutritional management will be taught. Okay. So microminerals iron. Iron also we require in very trace amount. but it is a very important mineral for your growth, development, and body functioning. Okay. Even though uh, the requirement in iron what we take on a daily basis would be around 15 to 27 mg, considering all the age groups. Okay. For pregnant women it is around 27 mg, but 3 to 5% of that iron is the only ratio that is getting absorbed in your diet. Okay. Only 3 to 5% of the iron that we are consuming is taken in the is been absorbed by the human body. Okay, because it is very tricky. Iron is a very tricky. Okay, yeah, this is a repetition class for this topic, because in the previous week Wednesday we took anemia. Okay, so considering for the new students we are taking this topic today to have that flow. Trace minerals or micro minerals, okay, which means we require this in very few amount. Okay, and note that iron is considered to be a trace mineral, although the amount needed is somewhere more than other micro minerals, but still the way how iron is absorbed in the body, okay, it is very less. Other trace nutrients known to be essential in tiny amount include nickel, silicon, vanadium, cobalt. Okay, these are also the selenium. These are also the other trace minerals. But as if you compare iron to these all trace minerals, okay, slightly the requirement is higher. But we cannot consider iron as a macro mineral, because the way how we consume calcium, phosphorus, magnesium, sodium, okay, chloride, and these things are quite higher. Okay, above 500 mg, 1000 mg, and all we require these minerals. We can't consider iron in the same league. Okay, so iron is still a micro mineral. It's still a trace mineral, but as compared to other trace minerals, it is required very less. Okay. Coming to the distribution of iron in the human body, total body iron is around 3 to 5 grams. Okay, if you consider different sources in the textbook, they have given 2.5 to 4 grams. In some other sources, it is 3 to 5 grams, but usually you will not find any source which claims more than 5 grams. Depending on it's a population average. Okay, Indians, males and females both, 60% of the Indian population suffers from anemia. Okay, diagnosed and undiagnosed anemia. Majority of the population, Indian population, is in the undiagnosed category of anemia. Okay, so based on that, based on the Indian standards, it could be quite true what is mentioned in your textbook. 2.5 to 4 gram of iron may be what the ideal range of iron composition is in Indians, as compared to other Westerners. There could be 3 to 5 grams, slightly higher than what we have. Okay, so 60 to out of this 3 to 5 grams or 2.5 to 4 grams, majority of the iron is found in hemoglobin. Okay, hemoglobin runs throughout your blood. Your RBCs carry it. Okay, hemoglobin is found in the RBC. Hemoglobin is what pigments your RBC. Okay, it gives the red color to the RBC. 15 to 30% it is stored in liver and the reticuloendothelial system. RE system means reticuloendothelial system. Those who are from the medical background, you can mention which all organs come under this reticuloendothelial system, so that others will have an idea. Which all major organs in your body are part of this reticuloendothelial system? RE system means reticuloendothelial system. Which specific part of the bone? Spleen and bone marrow. Okay. your liver, your spleen, your bone marrow. Okay, they are the major part of your reticuloendothelial system. Okay, because this is where the iron is stored, as well as this is the area where the red blood cells are formed because of the presence of iron in your system. Okay, so in the liver, it is liver, and in the reticuloendothelial system, iron is stored in the form of ferritin and hemosiderin. Okay, ferritin, again, it's present in your plasma. It is being circulated. Ferritin is in circulation in your blood plasma. Okay, if the iron levels in your body is quite low, the ferritin count in your blood plasma will also be very low. So that is one of the way how we diagnose anemia. If you give the blood sample, if the ferritin levels is quite low than the normal range, it is understood that you have begun the process of anemia. Okay, you are in an anemic state, because if the ferritin levels are low, ferritin is is the iron store which is circulating in the blood plasma. Hemosiderin is also very similar to ferritin. Okay, they are very less active as compared to ferritin, but they still carry iron. Okay, they still carry iron in the blood circulation. So both of them, ferritin and hemosiderin, they store iron in the liver. They carry iron through the blood plasma. They deposit in the liver as well. Okay, that is a function of ferritin and hemosiderin. Then myoglobin is a muscle protein. So 4% of the iron is also found in your muscles in the form of muscle protein. And 0.1% of iron is found in transferritin. Transferritin is required for transferring the iron that your intestine has absorbed through food. Okay, whatever your intestinal mucosa has absorbed through food, you have to take that iron to the liver, to the other organs, wherever it has to be. It has to go to the bone marrow, wherever it has to be deposited. Iron has to leave the intestine and reach all these organs. So it is because of transferrin. Okay, so it is because of transferrin that this movement takes place from the intestine to various parts of your body, specifically your liver, reticuloendothelial systems, and even in your bone marrow. Okay, so this is how iron is distributed throughout the human body. Is it clear to all? There is a small table in your textbook also. They mentioned the same information on page number 227. Those who have the textbook, table 12.1, the same information is given. You can refer that as well. Coming to the functions of iron. First is transportation and storage of oxygen. So hemoglobin, as I have mentioned, is found in the RTCs. Okay, and here hemoglobin is the major container of iron in your body. So each gram of hemoglobin contains around 3.34 microgram of iron. Okay, so and it can, because of this iron within this hemoglobin, and also the iron which is found in the muscle protein, they can bind to oxygen molecules easily, and they can transport them through the blood and store them wherever it is required. If it is in the muscles, in the liver. Okay, muscles do require oxygen, because without oxygen, muscles will not contract, relax, it will not do its work. Okay, so the presence of iron in the hemoglobin ensures that oxygen molecules is getting attached to hemoglobin, and because of this attachment, wherever the hemoglobin goes through blood circulation, the oxygen is also getting deposited into those specific parts of your body. So that's how transportation and storage of oxygen is one of the main function of iron. Next is, it is a cofactor for enzymes and other proteins. Cofactor means helper molecules. Because of the presence of iron, iron helps to push certain other biochemical reactions in your body to take place. Okay, the presence of iron helps in the formation of certain enzymes, certain proteins. Okay, for example, when beta carotene is vitamin A from plant source. Okay, it's an inactive form of vitamin A. Whatever vitamin A you get from plant-based diet, yellow fruits and vegetables, yellow orange fruits and vegetables. Okay, that is in the form of beta carotene. So beta carotene has to be converted into active form of vitamin A, and for this conversion, iron is required. Okay, iron is going to be a cofactor here. So in the presence of iron, beta carotene can be converted into vitamin A, and the body can store, your liver can store vitamin A only in the form of its, only in the active form. It has to be in the retinol, retinaldehyde, these form. Okay, beta carotene has to be converted into these active forms of vitamin A. Otherwise, it will not be stored. Beta carotene is not capable to be stored in the body. It will leave your body from the intestine. Okay, so that what it means, if you're iron deficient, if you're anemic, automatically there are high chances that you will also become vitamin A deficient if you have a plant-based diet. If you have a plant-based diet, like if you're a vegetarian or a vegan, and if you're not sourcing enough iron from your diet, there are high chances these micro deficiencies can also develop over a period of time. Okay, you don't get vitamin A deficiency within a week or so. It takes months and months for you to come into a stage of vitamin A deficiency or iron deficiency. Okay, it does not happen overnight. Okay, these are fats. Vitamin A is fat soluble, so it does not happen overnight. Okay, no need to learn the tables, only the important tables which I will ask you to focus on, that you can mark as important. Okay, otherwise learning tables is much more easier than reading the entire paragraph. Okay, the snapshot of information is given to you. And also some other examples like synthesis of purines within your body, because of which, because of the synthesis, your body is able to make DNA, RNA. Okay, to make collagen in your body. Collagen is what keeps you youthful, your skin firm. Okay, the lack of collagen makes your skin look dull, wrinkly. Okay, aged. Detoxification of certain drugs in your liver in the presence of in the presence of iron. Detoxification of drugs and other toxic compounds is possible, even from the intestine. To make dopamine, serotonin, norepinephrine. These are the happy hormones, the excitable hormones. Okay, so this is also the reason why people who are anemic, they are depressed, they are at higher risk of falling into depression. Why? Their body is not able to make dopamine, serotonin, norepinephrine. Okay, norepinephrine is secreted by your adrenal gland. Okay, dopamine and serotonin are chemicals secreted in your brain, which excites you, which makes you happy. These are the happy hormones, dopamine, serotonin. So this, for the synthesis of dopamine, serotonin, and epinephrine, iron is required, in the absence of which a person can fall into depression. Okay, that is the reason why anemia is closely linked to depression. Next is the formation of red blood cells. Your bone marrow produces immature cells, and these are called erythroblast. Erythroblast is comes in various other forms. First, it is hemocytoblast. Okay, it's a stem cell. In the stem cell form, it is hemocytoblast. You will find a lot of stem cells in bone marrow. Okay, and before it converts into erythroblast, certain processes will take place. These are all technical part. You don't have to study this. Just for your understanding, I'm telling you how formation of red blood cells take place, how lengthy procedure it is. Okay, so bone marrow produces immature cells known as erythroblast. You can start from here: early erythroblast, late erythroblast. So there is a lot of processing that takes place for one single RBC to form. Okay, erythrocyte means RBC. Okay, the other name for red blood cell is erythrocyte. So for this erythroblast to mature in the bone marrow, okay, the presence of iron, specifically the heme containing iron, is required. Along with that, vitamin B6, folic acid, and copper. Okay, these are essential for the maturation of erythroblast. If in the absence of that, or in the deficiency of vitamin B6, copper, or iron, your bone marrow will not produce enough amount of RBC, which means you will become anemic. Okay. So once the erythroblasts are matured, they slowly become reticulocytes. They form into normocyte, and normocyte has to get rid of their nucleus. Okay, all the other cells of your blood, okay, like WBC, white blood cells, they have nucleus. RBC is a kind of cell which does not have nucleus. Okay, so in the maturation stage itself, the nucleus has to leave the cell body. Okay, and then it becomes a reticulocyte. In this form, reticulocyte form, the bone marrow expels the reticulocyte out into the blood, and the reticulocyte will stay in your blood for a few days to mature. Okay, it takes at least 24 to 36 hours. That is 1 to 3 days it will take. Okay, within these days, the nucleus of the reticulocyte has completely disintegrated. It has left the cell body, and now it is ready to become a mature RBC. Okay, so this maturation takes place in your blood. So once the erythrocyte has undergone maturation in the presence of iron, in the presence of vitamin B6, in the presence of copper, okay, it forms itself into normoblast. Normoblast is able to take out its nucleus from the cell body after the reticulocyte has been released into the bloodstream. Okay, so till this process, till this normoblast process, everything takes place in the bone marrow. After that, whatever happens is what takes place in your blood circulation. Okay, reticulocyte is the form in which the RBCs leave your bone marrow. It is when the RBCs leave the bone marrow, it is still immature. It has to circulate in your blood for at least 2 to 3 days, then it becomes a mature RBC, which can function well. Okay, what is the main function of RBC? To carry oxygen from point A to point B. Okay, so this is the formation of RBC, a very important function of iron. Is it clear to all? So since RBC does not have a nucleus, okay, since RBC does not have a nucleus, it cannot live long. It has a very short life, around 120 days. Roughly 120 days is the lifespan of RBC. After this 120 days, the RBCs will go to spleen for during the blood circulation. The old and the worn out RBCs are trapped in the spleen. Here in the spleen, it will do its salvaging activity, which means even though the RBCs are worn out, it is old, but it still contains heme. It still contains iron protein, right? Heme is an iron protein. So the body is always in a state of excavating as much of iron as possible. It will not try to get rid of iron. Okay, so it will destroy the RBC, but it will keep the iron, okay, for future use. That is the main function of spleen. Okay, so in the spleen, iron, certain amino acids from hemoglobin are salvaged and recycled. Okay, and it is stored in the spleen, or it may be stored with the help of hemosiderin or ferritin. It will go and store itself in the liver. And whenever the bone marrow requires more iron for more RBC production, these salvaged and recycled iron can also go back into the system, go back into the bone marrow for new RBC formation. Okay, so these are the main three functions of iron in our body. Coming to the absorption of iron. So dietary iron, it exists in two chemical forms. One is heme iron and one is the non-heme iron. Okay, heme iron, whatever non-vegetarian food you have, animal-based food you have, okay, heme iron comes from that hemoglobin, or it has some form of protein and enzymes attached to it. That is heme iron. Non-heme iron is usually found in the plant-based diet, but also in some animal food you can still find non-heme iron to an extent. So heme iron is majority, it is from animal sources, and it can be absorbed easily from your villi, from your intestinal cells. Heme iron, the iron which is from animal sources, can be absorbed very quickly from the intestine after it has been digested. Non-heme iron, it is tricky. It requires various conditions associated. For example, the presence of vitamin C, calcium should not be present. Okay, B complex should be present. There are various, we will discuss that factors which affects the absorption of iron. The free iron molecules which enter your food, which through the food which enters your intestine, the free iron molecules, they get absorbed in the intestine in the presence of ferritin. Ferritin is able to move the iron from the intestine into the bloodstream, and in blood you have transferrin. Transferrin will carry the iron from the intestine to the liver, spleen, wherever it is possible. So iron as it is, it cannot be deposited in the soft tissues. Okay, iron requires ferritin or hemosiderin. You can see in your intestine you have ferritin. In the liver they have shown a ferritin molecule. Even in the spleen they have shown the ferritin molecule. So under this ferritin molecule, only within this ferritin molecule iron can be stored. It cannot be deposited directly on the cells or on the soft tissues. Okay, it has to be, iron has certain mechanisms in which it has to form, it has to be stored under ferritin or hemosiderin. In the spleen and liver you will also find hemosiderin. Okay, hemosiderin is not found in the intestine, it is only found in the liver and your spleen. Okay, ferritin is found in the intestine, liver and spleen, wherever the iron can be stored. And ferritin, through ferroportin, they will give the ferritin to transferrin, and this transferrin levels are also still low in your blood, but it is capable enough to carry as much as of iron molecules wherever it is required. And transferrin, from the name itself you can understand, transferrin, transporting ferrin. Ferrin means related to iron. Okay, so this is how the absorption and the transportation of iron within your body takes place. Free molecules of iron will get absorbed, but it will stay inside the ferritin. With the help of ferroportin, ferritin is able to exchange these free ions into the blood. Okay, in the blood you have ferrin, that they will catch the free ions, store it, and then transport it wherever required, usually the liver and the spleen. Even when they come to the liver or the spleen, free ions are not deposited in the soft tissues, soft cells of the liver or spleen. It will be stored in the ferritin part of the liver and the spleen. Is it clear to all regarding the absorption? Heme iron is absorbed more than 25% as compared to non-heme iron. Coming to the metabolism of iron, how is iron removed from the body? Through your feces, when you defecate, at least 11 mg of iron is lost. Since, as I mentioned, whatever iron you take, hardly 3 to 5% of that iron is lost. Okay, so take any age group, their iron absorption should be at least slightly higher than 15 mg of iron per day on a daily basis. This much has to be maintained, man or woman. Okay, woman has to maintain slightly higher, but even for men, at least 15 mg of iron on a daily basis you have to ingest, because at least 10 to 11 mg you are losing through your feces. As it is, the absorption context is very low when it comes to iron. Okay, in females you lose around 28 mg of iron on a monthly basis because of menstruation. Women who are in the reproductive age group, 28 mg of iron per period every month you do use to lose. And then disformation, okay, it's commonly known as skin peeling, which happens at a higher rate in winter seasons. Okay, yeah, even in children, the defecation rate, it could be 9 mg, 10 mg based on the portion sizes that they have, but still it's a big loss. Okay, through feces you are losing 11 mg of iron, means it's a big loss. Whatever iron you are having, very less percent of it, hardly 3 to 5% of the iron that you can eat from your diet is being absorbed. Okay, so disformation means skin peeling. In winter seasons, disformation rate is quite high. So during winters, you lose majority of iron as compared to other seasons. Okay, and people who suffer from these conditions like psoriasis, itchy skin, dermatitis, okay, they also suffer from a lot of skin peeling. So they also have to amp up their iron intake. Okay, so this is how you lose iron from your body. Then we have ion balance. So in ion balance, how does the body, as we have seen, very less amount of iron is able to be absorbed and a lot of iron you lose. There are various other way in which you can lose iron more than gain it. Okay, so there should be a way in which your body is trying to create a balance. Okay, so one way of doing it is reutilization from catabolized red cells, which happens in the spleen, as I mentioned during the formation of RBC. The old RBC, the worn out RBC, the RBCs which are going to end their life cycle, okay, when they reach the spleen is able to break the RBC down, okay, hemolysis takes place in the spleen, and with that, as much as possible heme and as much as possible salvageable iron will be saved. Okay, that is the reutilization of iron from catabolized. Catabolized means broken down RBC, hemolysis. Okay, so that is one way of creating an iron balance, not to lose majority of the iron. Then we have the upper limit cessation in absorption. It happens, it's a very rare situation. So when you all have enough amount of iron in your diet, okay, like you are not deficient in your liver, spleen, blood circulation, you have more than enough amount of iron, you don't require any further iron, automatically the message is sent to your intestine not to absorb any more iron. So that is upper limit cessation in absorption. We have reached an upper limit. If we take more iron, it will lead to toxicity. So automatically your system goes into a stage of cessation. Catabolism means breakdown. Catabolism means breakdown. Then ferritin. Ferritin is a protein. It's a storage protein. It is found in your intestine, liver, and also spleen. And it can store and release iron as and when required. Okay, it will hold on to as much as iron possible. It's a protein, so it is able to bind with iron. It will hold on to as much as iron possible. And whenever the iron stores are going down, ferritin will release the iron for the body to meet its iron related functions. Okay, so these are the ways in which iron balance is created. And specifically, the role of ferritin increases during pregnancy, in the last trimester of pregnancy, when the iron requirement is high, the absorption rate is quite slow. Okay, in the last trimester of pregnancy, a lot of indigestion, constipation, absorption related issues, digestive issues mothers face during the last trimester of pregnancy. So it can also lead to depletion in the iron stores. So the role of ferritin usually kicks in its full fledged during the last trimester of pregnancy. Okay. So these are the three main ways in which your body is able to create a iron balance. Is it clear to all? Now coming to the difference between heme-based iron and non-heme iron. Heme iron is the bioavailable iron, which means your body, your intestinal mucosa, is readily accepting this form of iron. It can readily absorb this form of iron. Okay, it's the natural form of iron. Non-heme iron is usually from the plant source, and it comes in it has to be converted into absorbable form of iron, and then it can be stored in ferritin. It can move to transferrin and be stored in the liver. Okay, so that is non-heme iron. Majority of the plant-based food, the iron from the plant-based food usually are in the form of non-heme iron. Your body has to convert it into heme, which means the body has to add the protein into it. Heme iron means iron plus a protein. Okay, so with the presence of this protein, easily it is absorbed. As soon as a protein component is added to a mineral, easily it will be absorbed. Okay, in non-heme iron, plant-based iron, the protein content is not there. Okay, iron is available in its excitable form, ferrous, in the ferrous form as it is. Okay, so the body has to attach a protein source into it, a protein point into it, and then it can be easily absorbed. Okay, it is easy on stomach. Heme iron is easy on stomach. You can take it even without food if you are taking a supplement. Okay, supplements also come in heme form, non-heme form. So specifically, if you are focusing on supplement, you can take this heme supplement without food. On empty stomach, you can take it. Okay, but the non-heme iron, you cannot take it on empty stomach. It may give you some side effects as well, and it is not affected by the stomach acid. It survives the stomach acid, and the non-heme iron, it requires an acidic environment. It requires good amount of hydrochloric acid secretion in the stomach. It requires vitamin C, also presence of vitamin C. And if you are taking any antacids means those who suffer from acidity, they take antacid to reduce the secretion of hydrochloric acid in your stomach. Okay, so if you're taking antacids can block or suppress the absorption of non-heme iron supplements. Okay, and the heme iron supplements, they are in the natural form. They are not genetically modified. Okay, they are in the most natural form. And the non-heme iron, they come in the synthetic iron salt form. Okay, for example, ferrous sulfate. Okay, that is an iron salt. Ferrous fumarate, ferrous gluconate, they all come in a salt form. Absorption is inhibited by calcium, which is more than 300 mg in that particular serving. Whenever you are having an iron supplement, okay, or iron rich food, but with along that, if you're taking a calcium rich food in portion size, if the calcium content of the food or the meal that you're having during the iron supplement is more than 300 mg, then it can lead to suppression, inhibition in the iron absorption. Okay, but if the calcium is less than 200 mg in a diet, for example, palak paneer is a good example for this. Spinach, that is palak, it's a good source of calcium, but also it's a good source of iron as well. Okay, so when we add paneer into it, you are adding a protein component into it. You're adding a protein component into that recipe. Okay, so with the presence of this protein component, iron absorption is getting enhanced, but you will not expect a lot of calcium to be absorbed here because spinach has a lot of oxalates and phytates. It does not have phytates much, but it has oxalates. So oxalates will try to inhibit the absorption of calcium. Okay, so iron slightly has an upper hand here. Okay, and if you are using paneer also has certain amount of calcium, but the presence of oxalates may again suppress the absorption of calcium in the palak paneer. Okay, so when you are having palak paneer, you can focus more, you can consider that a recipe which gives you a good protein and iron. Okay, should not depend on your calcium requirement on palak paneer because there are a lot of suppressing factors. Lot of suppressing factors for calcium absorption is present in palak paneer as compared to iron. Okay. Even if the paneer has calcium, the calcium content in the paneer is also suppressed by the presence of oxalate in the spinach. Okay. Iron will disrupt the calcium absorption. Iron has an upper hand here because the presence of vitamin C. Spinach is a good source of vitamin C. The presence of protein from palak. Okay, so iron is having a more active factors for absorption as compared to calcium when it comes to palak paneer. And when it comes to non-heme supplements, you have a lot of agents which may block or inhibit the absorption of non-heme based supplements like calcium. Even if it is slightly higher than 150 mg per serving, it can block the suppression or it can suppress the absorption. Okay, so serving milk, coffee, tea, wine, chocolate, cheese, beer, green leafy vegetables, eggs, nuts, yogurt. Okay, they all are sources which can inhibit the absorption of non-heme iron. So coming to the enhanced absorption factors, how iron absorption can be enhanced with the help of which other minerals, vitamins, or conditions. So more acidic if the environment, if the gut environment is acidic in the presence of hydrochloric acid secreted by the stomach, or in the form of having citrus fruits rich in vitamin C, okay, ascorbic acid, citric acid, lactic acid, malic acid, tartaric acid, okay. So in the presence of these acidic environment, there will be an enhanced absorption of iron. So if you are having iron supplement along with some citrus fruit juice, pineapple juice, orange juice, amla juice, okay, something like that. If you're having your iron supplement with a citrus fruit juice, the absorption of that supplement will be quite high. Animal tissue protein, milk, meat. Milk is not a tissue protein. Okay, meat, poultry, fish. The presence of these food in the meal can enhance the absorption of iron 2 to 4 fold. 2 to 4 times will be the absorption of iron in the presence of animal tissue protein. So animal tissue protein is something only non-vegetarians can have. Vegetarians do not have the option of any animal tissue protein. Other animal protein that vegetarians can have is through milk, curd, okay, which is not the animal tissue. And based on your body need, for example, during pregnancy, automatically the body's requirement of iron is increased. So naturally, the absorption rate of iron will also be increased. Okay, it's a physiological change that the body does. Okay, and when you undergo some surgery, or when you just had some, you have donated blood. Okay, you have done blood donation, you just had surgery, or just you had an accident and a hemorrhage was there. So naturally the iron stores in the body is going down, right, because of hemorrhage, excessive bleeding. Okay, even the women who menstruate a lot, okay, heavy menstruation, so in them also the absorption rate of iron is slightly higher than the women who do not have heavy periods. Okay, so why? It's a physiological change the body does. Okay, the body has an awareness that the iron stores are depleting, so the absorption should be full-fledged. So that is the body need. Lactoferrin and lactalbumin. So in the presence of, although the iron content in human milk is very low, and in cow's milk it is much more, it is much more lower iron content. Human milk's iron is better absorbed by an infant as compared to the iron present in cow milk, which is completely negligible. Okay, you cannot count the iron present in the cow's milk as even a source of iron. Okay, why human milk iron is better absorbed? Because of the presence of lactoferrin and lactalbumin present in breast milk. And because of these two factors, the infants who are breastfed, they are able to retain as much as iron possible from the breast milk. Okay. If usually the normal period should be between 4 to 7 days. It is very subjective, but even throughout the 7 days or even after the 4th day, you have to change more than 3 pads, means you come under the category of heavy menstruation. So these are the two factors because of which iron absorption improves in infants. Then calcium, adequate amount of calcium can remove certain agents like phosphate, phytate, oxalates away from the food. Okay, so that iron absorption can be enhanced. So this is the reason why as I mentioned about palak paneer, okay, In palak paneer, there is adequate amount of calcium and there is a lot of oxalates present, okay, in palak paneer. So calcium, instead of getting absorbed, calcium is making these um, precipitates, okay, with these oxalates. The calcium is engaged in making precipitates. So it is kind of paving the way for iron absorption to happen, okay, because calcium is reacting first with the oxalates. Calcium from the paneer, calcium in the spinach itself, okay, is forming these precipitates. Precipitates are undigested food. It cannot be absorbed at all, okay. These precipitates will be uh, leaving your body through your feces as it is. It will not be absorbed at all. So calcium present in palak paneer is more active in making these precipitates, or it is going to mix with agents like some phytates and phosphates, and it is kind of paving a way for iron absorption to take place. So only adequate amount of calcium, not much, adequate amount of calcium can do this trick, okay. So that's why I have mentioned, if the if it is a if you are having a non-vegetarian iron source, even up to 200 mg of calcium in that particular meal, or up to 300 mg of calcium in that particular meal, will have no effect on iron absorption, okay. If you are having a vegetarian meal, okay, by vegetarian iron rich meal, calcium content which is less than 150 mg in that particular meal can enhance the absorption of iron, okay. But more than that, in a vegetarian meal, more than 150 mg of calcium in a same meal, okay. If it is a completely different meal, no worries. But in the same meal where you're going to have an iron rich recipe and you have calcium which is more than 150 mg, that could lead to malabsorption, okay. Do not take iron supplement with milk. Calcium supplements you can take with milk. Iron supplements, don't take it with milk. So all the enhanced absorption food, is it factors, is it clear to all? Yes, you can take iron supplements with lemon juice. Coming to the inhibiting factors of iron absorption, low gastric acidity, just the opposite of what we have discussed right now. If there is a decreased secretion of hydrochloric acid, or if you're taking any antacids, okay, so that could lead to low HCl production. Or if you have undergone any gastric bypass surgery, so the mucosal cells may be scarred, so you are not producing enough hydrochloric acid. So in that condition also, and if you're not taking any vitamin C rich food, that will also lead to low absorption of iron. So increased gastric motility, if you have too much of fiber rich food, okay, too much of fiber will reduce the absorption of iron. Iron requires a substantial amount of time to be spent in your intestine, specifically if it is a plant-based iron, if it is a non-heme iron source. So it will require a substantial amount to be spent in the intestine to get absorbed slowly. So if the gastric motility is increased because of fiber-rich food, it will be thrown out of the body, okay. That's the presence of phytates and oxalates. Oxalates are found in all the green leafy vegetables. Phytates are present in whole grains. Okay, the like whole grains, multigrains. Okay, they are found in soya products as well. Phytates can inhibit both calcium absorption and oxalate absorption. So this is the reason why if you're having any phytate rich or oxalate rich food, you should have some amount of calcium with that, so that calcium can take care of phytates and oxalates, so it will not harm the iron much, okay. And if you are having any fermented food, if you are doing any form of fermentations, fermentation can degrade the phytates and oxalates. Fermentation can cut the phytates and oxalates. It can increase the iron absorption, okay. So that's the reason why foods like kimchi and all, or any fermented food, okay, iron absorption is increased because phytates and oxalates are degraded. It will not stop the iron from absorption. Polyphenols, which are present in coffee, tea, cocoa, and some vegetables that can also reduce the absorption of iron by 70%. Okay, so do not have your iron supplements while you're having tea or coffee or chocolate. Whole oats, unfold oats may contain phytates as well. Minerals like zinc, cobalt, calcium, cadmium, copper, okay, they have competitive absorption with iron, means they compete with the absorption of iron. They don't, they also take the same pathway of absorption of iron. They may close the pathway for iron. So they have a competitive relationship with iron absorption. Calcium also interferes with iron absorption if it is more than 150 mg in plant source and more than 200 mg in animal source. Certain infections, if a child or even as an adult, if you are falling prey to recurrent infections over a period of time, that could also reduce your iron absorption. Not just iron absorption, but all the other minerals, vitamins also will be low. Non-tissue proteins like milk, cheese, eggs, they decrease the iron absorption. They are high in calcium. So these are the inhibiting absorption rates. Is it clear to all? Coming to iron toxicity, overload of iron. Hemochromatosis, which means, again, not in the form of ferritin, but even in the form of free iron. Okay, free ions, free ferrous ions, iron molecules will be deposited on the liver. So that is a hemochromatosis liver. Okay, so healthy liver and hemochromatosis liver, you can see how it looks. It is completely inflamed, enlarged hepatomegaly, enlarged liver, painful, tender. Okay, it could lead to liver cirrhosis, jaundice. Okay, any abnormality or any anomaly that happens to the liver at its cellular level will kind of give rise to jaundice. If untreated, it will lead to cirrhosis of liver. So if not treated well, it could lead to diabetes, cirrhotic liver, death as well. Too much of iron in the diet, or if you are cooking a lot of food in cast iron kind of um, uh, utensils and not changing the food from the cast iron utensils, that could also lead to hemochromatosis. Having too much of alcohol, eating raw seafood, having too much of iron fortified food. Okay, try to avoid cooking too much in cast iron cookware if possible. Don't take too much of vitamin C. Yeah, B12 and iron can be taken. Any vitamin B complex and iron tablets can be taken together. The second form of overload of iron is siderosis. So again, here nutritional iron overload because of the same reasons which I have mentioned earlier, or usually if you're having more than 100 mg of iron on a daily basis, that could lead to siderosis. So here again, the free ferrous ions, they get deposited on the soft tissues of your body. Like in the pupil, you can see here, the pupil has a rusty appearance because of the deposition of free ferrous ions. Okay, and also people who work in iron mines, miners, okay, who work in iron mines, they also are susceptible to this condition. Or a lot of dust from mining activities that take place, that can get accumulated on their body, or they are breathing that iron dust, iron. that could lead to siderosis. So using proper personal protective equipments like using eye goggles, using mask while mining, okay, these kind of occupational safety instruments, if you are providing, they would be saved. Siderosis anemia, we have discussed in detail in the Wednesday class we have done previously. If you require the playlist of Wednesday classes, disease condition classes, please WhatsApp me right now. For the students who have joined recently, you can WhatsApp me on my UK number. Please WhatsApp me right now. I will forward you the playlist for all those who have asked after the class. So please go through that session. All the different forms of anemia, okay, all the different forms of anemia we have discussed in detail. Some part of its medical management and nutritional management has also been discussed in that class, but you will have an idea of what is anemia, what are the different forms of anemia, inherited, non-inherited, nutritional, okay, there are different classifications of it. So in detail we have discussed, so in such a way that we have reduced the use of medical terminologies, so even the students who are not from a medical background or from a healthcare science background, it is this the class we have took in the previous Wednesday is much more easier for you. Okay. Those who are from the medical background or a healthcare background, this will be kind of a revision for you, the Wednesday classes for the disease conditions. For others, 2 to 3 times you may have to go through the same recordings to get a hang of it, what actually the disease conditions are. Okay. So siderosis anemia, in siderosis also, too much of iron can also lead to anemia. Too much of iron can also lead to anemia because too much of iron will go and get deposited in the hemoglobin, and it will make the hemoglobin malfunctional. Hemoglobin should have exactly 3.34 mg of iron. That is a healthy, okay, around 3 mg of iron should be there in the hemoglobin. If anything is more than that, the hemoglobin will also become malfunctional. Okay, that is siderosis anemia. So coming to the RDA, recommended daily allowances. Remember, for pregnant women, it has to be 24 microgram per day. That is important. And it can be achieved through iron tablets. And also in adolescent girls, also the daily requirement for iron is slightly higher than the pregnant woman. And this has to be achieved in government schools, public schools. Free iron tablets are distributed to girls, adolescent girls, okay, as soon as they have attained menarche. Menarche means first time when you get the pre-periods, when you hit the puberty for the first time, girls, okay, menarche. So from that age onwards, free iron tablets are given. Even before that, by 6th standard, 7th standard, iron tablets are distributed in government schools and public schools. And the best sources of iron, garden cress seeds are known to be good source of iron. When we say about the best sources of iron, please understand that in per 100-gram portion, okay, which food gives you the maximum amount of iron, that becomes the best source. Okay, throughout the textbook, there are various other fruit, cereals, pulses, anything that is grown on soil, okay, that will have calcium, iron, all the minerals, okay, but per 100-gram portion when you take, okay, which type of food is giving you the maximum amount of that particular mineral or vitamin, that becomes the best source. Okay, so dates are a good source of iron, but you can't overdo dates because your glycemic index uh, will be high, or blood glucose levels will be high. Okay, and it is a good source of fiber as well as iron, but too much of consumption of dates is not healthy because of blood glucose level reasons. Pulses are also good sources of iron, but you will have to check the uh, table that they have given, which pulse comes under this category. Horse gram, gingerly seeds, okay, says that are seeds. Liver for non-vegetarian, organ meat. Ragi is a cereal, is a millet. Per 100-gram is uncooked. Per 100-gram is uncooked version that is given. Cereals, green leafy vegetables. Liver as an organ meat from any source, pork, uh, beef, sheep, okay, chicken liver, okay, any form of liver which is liver is an organ meat, okay. So that's a really good source of iron. In fish, tuna, mackerel, crabs. Crabs are good source of selenium as well, other minerals as well. Gingerly seeds means sesame seeds. Till. Gingerly seeds means till, sesame seeds. If you eat ragi dosa with curd, it will reduce because curd is not an animal protein. It is a animal tissue protein. It's a non-tissue protein. Curd is a rich source. It is a good source of protein, but it's a really good source of calcium as well. Okay, ragi also has high amount of calcium as well. So the calcium component will be much higher and it will inhibit the absorption of iron. Okay. If you are having any irritation in the thoughts in your throat because of dates, there are high chances that you may be allergic or sensitive to oats. Sorry, to dates. So anemia in detail we have taken in the previous class. You can please go to that uh, recording. If you have any queries, you can reach out. So in detail we have discussed ways to tackle anemia. If it is iron or nutritional deficiency anemia, only then it is related to this chapter. Okay, so and supplements has to be taken. Heavy blood loss during menstruation, again iron supplements has to be taken. Worm infestations that happens in children. Children are more prone to getting any helminthic infestation, tapeworm, hookworm. Okay, that also leads to blood loss through intestine. That leads to anemia, and these parasites will take up all the iron required for the host body. And then chronic kidney ailments and like CKD, kidney stones, hypothyroidism, endocrine abnormalities like diabetes and all. Okay, in that also chance of anemia, risk of anemia is high. If the body is unable to absorb iron due to some medical reasons, maybe because of some surgery or the patient is under certain drugs or drugs, chemotherapy, radiation therapy, okay, they will reduce the absorption rate in your intestine. The main concern of iron deficiency anemia in Indians is the way how we are dependent on vegetarian sources of iron. That is one thing. Second is the bioavailability of iron is quite low in Indian diet. Okay, and nutritional iron deficiency is the most common form of anemia we see in India. Okay, so not having a proper balanced diet, that is one of the reasons why anemia is so prevalent in India. Okay, so vegetables rich in iron should be included in your diet: spinach, carrots, radish, beetroots, tomatoes, potatoes, green leafy vegetables, fruits like bananas, apples, pomegranate. Sapota is the chiku. Okay, iron supplements should be taken under medical advice, and in some cases, in some severe cases like hemorrhage or any medical conditions in which a lot of blood loss has taken place, in that case, blood transfusion. And in severe form of anemia, also blood transfusion will be required. Symptoms of anemia: weakness, fatigue, shortness of breath, giddiness, specifically in girls and women. If you sit for a long time and you stand up immediately, okay, you feel that head rush. That is also a reason of you being in some mild to moderate category of anemia. Frequent headaches, increased heart rate, palpitations, pale, dry skin, irritation in the mood, low energy, lack of focus. In school children, low energy, lack of focus, irritability, signs and symptoms of depression. Okay, diagnosis: you have to do blood test. Okay, just by looking at somebody's skin color or just by looking at their eye color, you cannot come to the diagnosis. You do not know what form of anemia they may be suffering from. Always go for a blood test. Okay. RBC count, WBC count, complete blood test. And in some cases, bone marrow examination will be done to find out what is the iron storage capacity. But these are done in cancer patients as well, those who have undergone a lot of chemotherapy and radiation therapy. For them, bone marrow biopsy is done just to understand what is the iron storage capacity here. Not for regular people. Okay, not everyone has to do bone marrow biopsy. Regular people, you just have to get your hemoglobin. The best way is to check your hemoglobin. It is done immediately. And to know more details, check your transferrin levels and ferritin levels in your blood. Hypothyroidism does not only impact the iron absorption, but it also impacts it slows down your metabolism. Okay. And it impacts your other body minerals also. Okay. It can, or your iron deficiency can lead to hypothyroidism. Both is interchangeable. Hypothyroidism can cause iron deficiency, and iron deficiency can lead to hypothyroidism. And in some cases, in some hypothyroidism cases, why your metabolism falls down is the amount of pancreatic juices, gastric juices, hydrochloric acid that you produce. Okay, it is lowered in some cases of hypothyroidism. These juices, hydrochloric acid, gastric juices, pancreatic juices, the secretion of these enzymes and juices gets lowered. So definitely it will have an impact of iron absorption and leading to iron deficiency anemia. For hypothyroidism patients who are taking iron supplements, it is only under the guidance of your endocrinologist. So causes of iron deficiency based on your age or the physiology of body. One is your increased needs in adolescence, in your teenage. That's a rapid growth spurt age, and the body has an increased need for iron. And if the diet is not able to keep up with that increased need, automatically the child goes into a state of anemia. Menstruation, heavy menstruation, okay, pregnancy, physiological need of iron rises during pregnancy. If the diet is not able to keep up or the supplements is not able to keep up, the mother may become anemic. If the mother is is being anemic, the child born to her will also be born with very low iron stores in the body. Okay. Lactation. Again, during lactation, the mother's iron, there are high chances that the mother may fall into anemia. Cancer, as I mentioned, because of cancer, chemotherapy, radiation therapy as a management, it reduces the absorption of iron. Not just iron, but general gastrointestinal absorption reduces a lot during chemotherapy and radiation therapy. Insufficient intake, if you are following a vegan diet, and if you have a very limited diet, for example, or you are on a fruit diet or a liquid diet for a long term. Okay, so in that cases also, the intake of iron reduces. Malnutrition can impact any age group, specifically children. So that leads to anemia. Decreased absorption, there could be your gastric pH is high, that is your intestines, your stomach is more alkaline in nature. It has to be acidic. It is more alkaline in nature. If you have undergone any bariatric surgery, that is gastric bypass surgery, usually done to treat obesity. Okay, it's a surgical management for obesity. And then vitamin C deficiencies can also lead to anemia. All the other causes are given on page number 240, table 12.6. From infancy, if the mother is anemic, the child born will be anemic. The child may be born low birth weight, or preterm babies are also anemic. Okay, multiple births, twins, triplets, quadruplets. Okay, in that case also children are prone to be anemic. And if the mother is a strict vegetarian, and if the infant is breastfed by a strict vegetarian mother, high chance of being anemic. Or a vegan mother, if the child has not been started on weaning diet at the right time. Okay, for vegetarians and vegan mothers, it's better after childbirth. By the 5th month of age, you can start the weaning diet. Along with exclusive breastfeeding, it's better you should start weaning diet by the 5th month of age. For non-vegetarian mothers, you can start the weaning diet a bit later. Let the 6 months be complete, and then you can start the weaning diet. But for vegetarians and vegan mothers, they can start a bit early because the child may be having a low iron stores. Any inflammatory diseases, inflammatory bowel diseases, IBS, celiac disease, colic disease, okay, they can also lead to iron deficiency, worm infestations, early marriage, teenage pregnancies, teenage marriages, okay, child marriages. These are social customs and problems that could lead to iron deficiency. Clinical findings: immunocompetence, which means people who suffer from anemia, their immunity is reduced. Specifically, as an early sign, if you're getting a lot of infections, you are susceptible to a lot of infections throughout your life, which means your iron stores are quite low. Increased rate of upper respiratory tract infection, that is getting cold, getting flus again and again. Okay, fungal infections like candidiasis, if you're prone to that as well, that is also a sign of iron deficiency. Diminished work performance, you get fatigued easily, you get tired easily during work, your performance drops day by day, and it is seen in girls in schools as well. Lack of focus in schools and studies and homework. Cognitive development of children who are anemic, that is delayed. And early iron deficiency from birth itself, if it is not corrected, it can lead to irreparable damage. Okay, mental retardation, and so. And children who suffer from ADHD, depression, sleep disturbances, okay, that could also be seen as a part of cognitive development, impaired cognitive development. Behavioral implications: children who are anemic are more disruptive, irritable, restless in classroom. That is, they may suffer from mild to moderate form of ADHD as well. They have a high tendency of eating mud, ice, okay, like pika, having unnatural tendencies to eat these non-edible items like ice eating, mud eating, clay eating, chalk eating, okay, throwing a lot of temper tantrums. And in infants and toddlers, if they are holding their breath while they're crying, okay, throwing temper tantrums, and when they cry, they hold their breath for a long time. Sometimes they faint out of that. When they cry, their cry is so shrill that they're not able to catch their own breath, and they hold it for a long time. So that could lead to them fainting. Okay, so this is also a sign of anemia. Teenagers who are anorexic, okay, that is also a behavioral implication. Structure and function of the skin and epithelial cells that changes. You lose a lot of hair, premature graying of hair, folliculitis, that is inflammation of your hair follicles, acne, reduced growth of nails, brittle nails. And in severe cases of anemia, you will see koilonychia. Koilonychia means spoon-shaped nails. So this is the diagnosis. Diagnosis range, normal range may slightly vary from laboratory to laboratory, but this is something very common. So when you do a blood test, your serum ferritin level, if it is less than 15 microgram per liter, it means you are anemic, it is decreased. If the serum iron level is around 10 to 15 microgram per deciliter, okay, that also means you're anemic. Transferrin saturation, if it is less than 15%, means anemic. And this is the sign of toxicity, the remaining three. Okay, total plasma iron binding capacity. If it is more than 350 to 450, it means you increased. It's a chance of toxicity. Serum transferrin receptors are also high, means toxicity. Red cell protoporphyrin, that is, if it is more than 200, toxicity. Okay. So toxicity, you don't have to worry much. You just have to understand these three ranges. Don't have to by heart this. Just understand when you do a blood test, these are the levels that you have to look for. Serum iron level, serum ferritin, serum transferrin levels, saturation levels. So they will give you what form of anemia you may be suffering from, mild, moderate, severe. Because whenever anemia takes place, it takes place in stages. Okay. First, your ferritin levels drops, then your transferrin level drops, then your hemoglobin level drops. Okay. When the hemoglobin levels are lower, it means you are anemic. Okay. Your transferrin and ferritin levels are much lower. With dietary changes, ferritin levels can be corrected. Transferrin levels can also be corrected. But when hemoglobin has fallen down, it means you may have to be put on iron supplements under prescription. So the treatment, oral administration of ferrous sulfate, 50 to 200 mg. Why 50 to 200 mg? It depends on your age. Okay. 20 mg is usually given for children who are 6 to 24 months old. Children who are below 5 years old also they are given 20 mg. Okay. And girls, after adolescent girls, for them slightly higher dose will be given. 100 mg tablets are given of iron. Pregnant mother, 60 mg tablets of iron is given. And by the last trimester, slightly the dose will also increase. So prevention, first is your dietary improvement. Educate them regarding proper diet, which is rich in iron, which can prevent anemia. Okay. Importance of heme iron, non-heme iron. Okay. This kind of education should be given. Then it is the people's choice. If they choose to go for animal-based food, they can have animal-based food to correct anemia. Otherwise, even with the help of plant-based food also, you can correct anemia. Okay. Liver is an excellent source of iron for those who suffer from moderate anemia. Regular consumption of iron-rich food like whole grain cereals, pulses, nuts, dates, jaggery in your food. Lots of food of animal origin. Okay, vitamin C rich food along with these food, all the citrus fruits, and specifically for pregnant women, lactating women, adolescents, children, infants. This should be the focus of their diet. Having a lot of sprouted pulses for vegetarians. Okay, after that is also really good source of vitamin B complex and vitamin C. And do not cook the sprouted pulses or legumes too much. Try to have them as raw as possible. Supplementation I have discussed under reproductive and child health programs, and even under the ICDS program, supplementation is given free of cost. From PHCs, you can avail the free folic acid tablets and ferrous sulfate tablets. Food fortification, salt fortification with iron along with iodine has been considered as a national level movement. Fortification of iron is not just limited to salt, but also to wheat flour like atta, rice, sugar, curry powders. Okay, fortification of wheat means you do not add high amount of any mineral here. The mineral is added in such a low amount that on a daily basis you are taking these food items. So it should not lead to toxicity. That is the focus of fortification. Definitely iron is present, iodine is present, but it is put in such a way that it does not lead to toxicity, but it will correct the deficiency. Okay. Then education, promotion of the consumption of pulses, green leafy vegetables, and other vegetables rich in iron and folic acid. This kind of education to the community is given. Actually, usually this educational work is done by ASHA workers and community health nurses, community health doctors. Okay, this is their department. Volunteers of ICDS and volunteers of other national level nutritional programs in India. It is their role to impart this education at the community level. Okay, which are the weaning food which is iron rich should be started for infants, because when you start weaning, your focus should be on iron rich food, iron and vitamin A rich food. It's a main focus. Awareness of mothers, specifically when they come to their prenatal visits during for at the PHC or the hospital. That is the perfect time to impart this education to them. And even when after delivery, whenever they come to hospitals or to the PHC for the immunization of their child,